Let's discuss face reading, the chronic bronchitis. Chronic bronchitis is a chronic, non-specific inflammation of the trachea, bronchial mucosa, and surrounding tissues. The onset is slow and the course of the disease is long. There may be repeated episodes before the condition worsens. Chronic bronchitis typically lasts for 3 months each year and can go on for two consecutive years or more. Common symptoms are repeated coughing, expectoration, and shortness of breath, and sticky white foamy sputum. Western medicine attributes the onset of chronic bronchitis to two causes. First is the compromised local immune system of the respiratory tract, resulting in the respiratory tract infection, and the second is the dysfunction of the autonomic nervous system that renders the respiratory tract easily irritated. Face reading. There are blood streaks on the tip of the nose and on both cheekbones or dilated capillaries on the lung zone of the ears. Part of the iris or the entire bulbar conjunctiva is covered with fatty substances that are yellow in color. Therapeutic methods. Patients suffering from chronic bronchitis should avoid catching colds. Exercise more to strengthen the body's resistance to diseases, consume a light diet, and quit smoking or consuming alcohol. Dietary advice: your diet should be light and easy to digest, and make sure you take a plenty of protein by eating such food as eggs, lean meat, and milk. Avoid foods that are cold, raw, overly sweet, oily, and spicy. Exercise. Do more physical exercise. Swimming is recommended in summer because swimming can not only improve the lungs' function of qi exchange, but also increase breathing capacity. Emotional adjustment. Therapy for chronic bronchitis takes a long time. You must be patient once infected with the disease and remain calm and in balanced state of mind. Family members should give the patient extra care. Harmful emotions should be alleviated in a timely manner. Medicinal diet therapy. Consume pumpkin and red date soup. Mix 150 grams of pumpkin, 2 red dates, and some brown sugar. Remove the pumpkin skin and cut the flesh into strips, then cook them with the red dates to make the soup. This soup relieves exterior syndromes and ventilates the lungs. It is an effective supplementary treatment for chronic bronchitis. Okay. So here are the points at the back and at the front. Massage. Acupoints such as the Fishu, Senshu, Yuke, Sangfu, Chesi, and Hegu all have the effect of relieving exterior syndromes and ventilating the lungs, replenishing the kidney to promote yang, dispersing the lungs to relieve coughing and clearing the lung heat. Continued massage treatment can relieve the symptoms of chronic bronchitis to a certain extent. Use your thumb, index finger, or middle finger to massage the acupoint. First clockwise for about 2 minutes, then counterclockwise for about 2 minutes. Stop when there is soreness and distending pain in the acupoint. Do this 3 times a day. Thank you for your attention.
Let's discuss liver yang headache as we continue with interviewing. Here we have a case history of a 14-year-old girl who had been suffering from recurring headaches since the age of 10. The headaches were severe and came approximately every 3 months. The headache was concentrated in the area behind the eyes, was throbbing, and was accompanied by blurred vision, vomiting, and what she described as fuzzy eyes. Apart from the attacks of severe headaches, every 3 months she also experienced frequent dull headaches in between. On interrogation, she said she suffered from chronic tiredness and experienced some tingling of her limbs. Her tongue was pale, slightly swollen, and had sticky coating. Her pulse was slightly slippery. The diagnosis: the headaches are very clearly of the liver yang type, which is confirmed by the throbbing character of the pain, the location behind the eyes, and the vomiting. However, there are two other patterns which are evidenced by very few symptoms. First of all, there is some liver blood deficiency, which is indicated by the chronic tiredness, the pale tongue, and the tingling. Liver blood deficiency is obviously the cause of the rising of liver yang in this case. Second, there is also some phlegm. This is evidenced mostly by the tongue being swollen and with a sticky coating, and pulse being slippery. The fuzzy eyes could also be interpreted as a sign of phlegm obstructing the eye orifices. This is a good example of the importance of tongue and pulse as pointers to a certain pattern, even in the absence of symptoms. For this reason, tongue and pulse pictures should never be discounted when they do not appear to accord with the presenting symptoms. For example, in this case of liver blood deficiency with liver yang rising, the tongue should have been pale and thin, and the pulse might have been wiry on the left and weak on the right. Why should the tongue and pulse show a certain pattern and the patient not show any signs of it? This often happens in young people when there is a certain pathogenic factor, in this case, phlegm. But due to the young age of the person, it has not given rise to clinical manifestations yet. The treatment principles in this case should therefore be not only to nourish liver blood and subdue liver yang, but also to resolve phlegm. Thank you for your attention.
Let's discuss acupuncture analgesia, central mechanism, molecules, and receptors. Opioids. Opioids including beta-endorphins, enkephalins, and dynorphins are endogenous peptides that bind with the receptors to create analgesia. Studies showed decreased acupuncture analgesia in rats that are opiate receptors deficient. Specifically, Cheng and Pomeranz noted the possibility that different frequencies of electroacupuncture elicited different mechanisms of analgesia. With inhibition of opioid receptors, subsequent studies concluded that low frequency versus high frequency electroacupuncture caused activation of different opioid receptors. Low frequency, 2 to 15 Hz, may increase enkephalin, beta-endorphin, and endomorphins working on the opioid receptors. High frequency, 100 Hz, caused release of dynorphin to K-opioids receptors in the spinal cord. However, hyperanalgesic rats have analgesic effect through the opioid receptors of both low 10 Hz and high 100 Hz frequency. This is contrary to the normal animal models that showed only the opioid receptors effect at low frequency of K-opioid receptors at high frequency. Overall, acupuncture potentiates opioid release in its analgesic pathway, especially with the different electroacupuncture frequencies. Cholecystokinin octapeptide. It is also CCK8 also has a significant role in the acupuncture analgesia. Increase in CCK8 via intrathecal injection in mice yielded less pain control under acupuncture, whereas CCK8 receptor antagonism showed greater analgesia. CCK8 production is increased in subjects that do not show anti-nociceptive effects of acupuncture and decrease in those responding to acupuncture analgesia. This suggested that CCK8 and its receptor had a role in reducing the effects of acupuncture. 5-hydroxytryptamine, 5-HT, also known as serotonin, is a neurotransmitter found in the gastrointestinal tract, platelets, and central nervous system. It helps modulate the sense of emotional well-being and decreases nociceptive pain primarily at the NRM in the brainstem. Dong and Jiang showed increase in 5-HT at the NRM in rats with acupuncture analgesia. Further studies by Chang et al. Showed a significant decrease in acupuncture analgesia when the 5-HT receptors were blocked. Both 5-HT1A and 5-HT3 antagonists block EA analgesia at low and high frequency, but 5-HT2 and antagonists enhance analgesia at high frequency at 100 Hz. These studies indicated that acupuncture modulates 5-HT release for anti-nociceptive effects. Thank you for your attention.
Let's discuss hepatitis, its differential diagnosis in Western and Chinese medicine. Let's start with the Western differentiation. Hepatitis could be caused by, hepatitis is inflammation of the liver caused by first infection from parasites, bacteria, viruses. That's hepatitis B, A, B, or C. It could also be due to liver damage from alcohol, drugs, poisonous mushrooms. It could also be due to immune cells in the body attacking liver, causing autoimmune hepatitis. Hepatitis A will present with jaundice, fatigue, loss of appetite, nausea, vomiting, low-grade fever, pale stools, dark urine, and itching. Hepatitis B will present with fatigue, malaise, aching joints, low-grade fever, nausea, vomiting, loss of appetite, abdominal pain, jaundice, and dark urine. Hepatitis C will present with jaundice, abdominal pain, fatigue, loss of appetite, nausea, vomiting, pale stools, low-grade fever, dark urine, itching, ascites, bleeding, varices from dilated veins in esophagus. Autoimmune hepatitis will present with dark urine, loss of appetite, fatigue, malaise, abdominal distension, itching, pale stools, nausea, and vomiting. Drug-induced hepatitis will present with jaundice, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, diarrhea, and pale stools. Alcoholic hepatitis will present with loss of appetite, nausea, jaundice, abdominal pain and tenderness, fever, ascites, weight gain, mental confusion, dry mouth, excessive thirst, and fatigue. Common risk factors include intravenous drug use, multiple sexual partners, unprotected intercourse, contaminated foods, foreign travel, alcohol abuse, organ transplant recipient, HIV positive or having AIDS, blood transfusion before 1990, healthcare worker, and having a tattoo. Now let's go to the Chinese differentiation. Let's start with organ interrelationships. Let's look into the spleen and stomach, liver and gallbladder, the internal and external relationships. Liver and kidney in the Shang cycle, liver and spleen, spleen and kidney in the Ke cycle. TCM diagnosis of jaundice. If it's acute, developing quickly, it's due to damp heat. If developing slowly, it could be due to cold, damp, or spleen deficiency. If the jaundice is bright yellow or yellow-orange, it's due to damp heat. If it's dull, darkish yellow, it's due to damp, cold, damp, or spleen deficiency, or qi and blood stagnation. The TCM diagnosis of hypochondrial pain. There's intermittent aching or descending pain, difficult to localize and worse with stress. It is due to liver qi stagnation. If it's fixed stabbing pain worse with pressure, it means blood stasis. If it's dull ache relieved with pressure and worse when tired or stressed, it's liver yin deficiency. it's a continuous severe pain and fullness, worse blood pressure, it's due to damp heat. Now, on its etiology, it can be due to damp heat, toxic heat, spleen deficiency, qi, and blood stagnation. The Zangfu organ patterns, if it exists, it can be due to stagnation of liver qi invading the spleen, damp heat in the spleen and stomach, damp heat transforming into fire in the liver, gallbladder, and brewing toxins. Could also be damp heat harassing the nutritive qi and blood stasis obstructing the network vessels, phlegm nodules. In deficiency, it could be cold dampness accumulating. Cold dampness accumulating internally is also an excess pattern. For deficiency, we have liver and kidney yin deficiency and spleen and kidney yang deficiency. Thank you for your attention.
Let's continue our discussion on relationships among Zang viscera, the lung and the liver. The relationship between the lung and the liver is demonstrated mainly in the regulation of qi. The lung is in the upper jiao and its qi moves downward. The liver is in the lower jiao and its qi moves upward. Thus, liver qi ascends on the left, whereas lung qi descends on the right. Both organs must function normally for qi to be regulated properly and for the vital activities of the body to be maintained. If the liver is blocked, fire is generated. Fire then moves upward along the meridians and injures lung fluid, leading to flank pain, irascibility, and coughing up of sputum and blood. This is wood fire pushing metal. Conversely, prolonged disease of the lung disrupts its depuration function. The dryness and heat evils then move downward and cause the liver to fail in its dispersion function. This may cause coughing, subcostal pain, impatience, and irascibility, headache, and dizziness. Here we see the relationship between the lung and the liver. The lung, which is found in the upper jiao, and the liver in the lower jiao. So the liver ascends upwards towards the left side to the upper jiao and descends on the upper jiao. Lung disperses and descends on the right side. So both are needed in the regulation of qi transformation. Thank you for your attention. Let's continue to talk about diagnosis according to Zangfu organ patterns. Today, the kidney imbalance etiology. The etiology of kidney patterns of imbalance. The kidneys encompass the most fundamental aspects of the body's qi. It is in the kidneys that jing is stored, and it is between the kidneys that mingmen is located. In contrast to other organs, the kidneys do not have any qi patterns of imbalance. This is because the kidneys comprise the fundamental yin and yang, and these can only become deficient. A deficiency condition in the kidneys can easily result in the emergence of qi conditions elsewhere in the body, but the kidneys themselves can only be deficient. Because the kidneys store jing and create yuan qi, they will be weakened when more qi is consumed than the body is capable of producing. This means that long-term illness, stress, working too much or too hard, a weakening of one of the other qi-producing organs, and bleeding can all put a strain on the kidneys. Working too hard physically will mainly weaken the kidneys' yang aspect, whereas stress, working too much mentally, or working late in the evening or at night, and sleeping too little will burden kidney yin. Yin is replenished at night whilst we sleep and when we rest. A person who sleeps too little and works or parties at night weakens their yin. The pre-heaven aspect of kidney jing is inherited from the parents. This means that the health of the parents at the time of conception and the mother's health during pregnancy will have a significant effect on the quality of a person's jing. The age of the parent also plays a role. The older they are, the weaker their jing is, and thereby the quality of the jing that they pass on to the child. In addition, there is a progressive weakening of kidneys over the years as a person gets older. At the age of 40, half of a person's yin has been consumed. Old age is characterized by signs that the kidneys are deficient. The hair turns gray or falls out. The teeth loosen. The bones are fragile. The hearing is poorer. The libido and fertility decrease. The memory fades. There is incontinence, and so on. Too much sex is an etiological factor in many kidney patterns of imbalance. This is because men lose jing and yang when they ejaculate. In fact, it is not only ejaculation that weakens the kidneys, because when you become sexually aroused, Mingmen flares up. This is why the cheeks, lips, and nail beds become redder and you feel warmer. When Mingmen flares up, it consumes jing. Some sources believe that all forms of desire activate Mingmen. This means that desire will weaken the kidneys on both men and women. Where men mainly lose jing through ejaculation, women lose jing through births, ovulation, and menstruation. The eggs are jing, and women therefore lose jing when eggs are released during ovulation. Jing is also used to nourish the fetus during pregnancy. Finally, heavenly water or menstrual blood is jing that has been transformed by Mingmen and heart fire. Standing and lifting weaken the kidneys, especially kidney yang. People whose work involves a lot of lifting or lifting heavy objects, and people who stand for long periods of time will strain their kidney yang. Invasion of exogenous deficiency qi do not directly affect the kidneys. On the other hand, repeated invasion of exogenous cold will weaken kidney yang. Invasion of exogenous qi, no matter whether they are hot or cold, can eventually lead to the generation of internal heat. This will injure the kidney yin, as will all fire conditions. Chronic disease and recurrent illness will be a burden on the zeng qi and thereby also the kidneys. Emotionally, the kidneys are affected by fear, anxiety, and shock. If these emotions are very intense or are a chronic condition, they will weaken the kidneys. This is often a vicious cycle. Fear and anxiety weaken the kidneys, but a person whose kidneys are weak will often be excessively and unnecessarily fearful and anxious. Treatment of disease can also weaken the kidneys. This can happen if the medication use has a very hot or a cold dynamic. Improper use of inadequate treatment can also draw exogenous qi deeper into the body or lock a remnant of qi in the body. This can injure the kidneys in the long term, either by generating heat, which injures yin, or by weakening qi and yang in general. Excessive consumption of an energetically hot or cold diet can burden kidney yin and kidney yang, respectively. Kidney yin shu and kidney yang shu can both result in and be the cause of yin shu or yang shu conditions in other organs, because kidney yin and kidney yang are the root of yin and yang in the whole body. If they are weak, they will not nourish or support the yin and yang aspects of the other organs. On the other hand, if an organ is yin shu or yang shu, it will consume that aspect of the kidney so that it eventually also becomes weakened. Kidney yin has an especially close relationship with the liver, heart, lung, and stomach yin. Kidney yang has a similarly close relationship with spleen, lung, and heart yang. Thank you for your attention.
Go to pathology and Chinese medicine. The topic is internal and external environment and pathogenesis, part 2. Psychological state. The psychological state of a person strongly affects the sufficiency of genuine qi. Hence, it is closely linked to the occurrence of illness. In general, a person with a mind at ease, harmony between qi and blood, and ample genuine qi is not susceptible to illness. Conversely, mental stress can severely disturb the functions of the Zangfu organs and reduce genuine qi, so much so that the pathogenic evils may invade easily to cause illness. A prolonged state of mental depression may lead to neglect of food and sleep, weakening of the constitution, hypofunction of the Zangfu viscera, and impedance of the flow of qi and blood, so that resistance becomes markedly reduced. This permits a variety of pathogenic evils to invade and cause illness. It is necessary to induce such a patient to build up confidence and develop a more optimistic look in order to enhance the capacity to resist and defeat illness. Only then can one reach the goal of expelling evil qi and restoring genuine qi. Moreover, CM recognizes that different mental states are correlated with different patterns of illnesses. In general, an excited mental state is correlated with illnesses of strength, whereas a depressed mental state is correlated with illnesses of deficiency. In clinical practice, a mixed pattern of deficiency and strength is also common. For example, prolonged mental stress can slowly wear down yin essence and allow liver yang to rise without opposition, or heart fire to blaze without restraint. This produces such symptoms as headache, dizziness, palpitation of the heart, and insomnia. Living circumstances. People from different patterns of habits in different living circumstances, hence a person's living circumstance also has definite effect on the susceptibility to illness. For example, people who live in a damp environment or work in water most easily develop diseases of cold and dampness. People who live in the mountains often develop goiter. Moreover, CM believes that excessive reading damages blood, excessive lying damages qi, excessive sitting damages the flesh, excessive standing damages the bones, excessive walking damages sinews, excessive mental activity or brooding damages the heart and the spleen, and excessive physical exertion or labor damages the liver and the kidney. It is clear that the living and working environment is significant in clinical diagnostics, especially in certain endemic or occupational illnesses. Number 4 is nutrition and sports. Nutrition and sports are important factors in strengthening genuine qi and in enhancing the ability to resist pathogenic evils. If nutrition is adequate and absorption effective, then qi and blood are sufficient, so that genuine qi is ample and its capacity to repel illness is normal. If nutrition is inadequate or the diet is unbalanced by preferences, then qi and blood will inevitably decline, so that genuine qi becomes insufficient and too weakened to repel pathogenic evils. The person then becomes more susceptible to illness. Regular physical activity or sports is an important way to facilitate the circulation of qi and blood, to strengthen the constitution, and to promote metabolism. Thus, it is said that flowing water does not decay and the used door hinge does not rot. Neglect of physical activity or sports, on the other hand, leads to impedance of qi and blood movement, weakening of the sinews and bones, and decline of genuine qi, resulting in lowered resistance to illness. Thank you so much for your attention. Let us now go to pathology of minister fire in emotional problems. The topic is importance of minister fire. The minister fire refers to the physiological fire of the kidneys. The minister fire is the motive force of all functional activities of the body, being the physiological fire that is essential to life. The minister fire should be concealed in its resting place in the lower burner. In other words, it carries on its function of heating the body, but without the creation of visible heat signs and symptoms. The importance of the fire nature of the minister fire is that it provides heat for all our bodily functions and for the kidney essence itself. The kidneys are unlike any other organ, in that they are the origin of water and fire of the body, the primary yin and primary yang, as we can see in the figure below. The minister fire is the embodiment of the fire within the kidneys, and it is a special type of fire in that it does not extinguish water, but it can actually produce water. The minister fire of the kidneys complements the yin quality of the kidney essence. As mentioned earlier, the minister fire is the physiological fire of the kidneys that provides the heat necessary for all physiological processes of the body. It should be concealed in the lower burner, carrying on its heating function without manifesting itself. Although the point due for is specific to tonify the fire of the gate of life and the minister fire, I personally prefer to use the point ren 4. The main functions of the minister fire are as follows. First, it is the root of the original qi, or the yuan qi. It is also the source of physiological fire for all the internal organs. Third, it warms the lower burner and bladder. It also warms the stomach and spleen to aid digestion. It also harmonizes the sexual function and warms the essence and uterus. It also assists the kidney function of reception of qi and assists the heart function of housing the mind. In the context of mental emotional problems, the importance of the minister of fire is that this is frequently and easily stirred by emotional stress, with the creation of heat and an upward movement of qi that goes up to disturb the heart and pericardium. As we have seen in emotional stress, heat is frequently the result of qi stagnation. However, in our experience, it may also arise independently without a preceding qi stagnation. When heat is formed under the influence of emotional stress, the minister of fire becomes pathological. It is stirred out of its residence in the lower burner and it flows upwards to the heart and pericardium. Some Chinese books actually say that the physiological minister of fire should be hidden in the lower dantian and it should not be seen. When there is heat, the minister of fire is seen. When the minister of fire is stirred into a pathological state under the influence of emotional stress, 3 patterns of heat may appear. Number 1 is full heat. Second is empty heat from yin deficiency. And third is yin fire. Here we can see how the pathological minister of fire is affected by the emotions, where the pathological minister of fire rises to the heart and pericardium and causes heat. Thank you so much for your attention.